Hi, Dr. Brian Kaufman. I'm the Chief Medical Officer at the Cialis Society here on ASH 2018 on the Monday.
And hi, I'm Lindsay Roeker. I'm a fellow at Memorial Sloan Kettering in New York City.
Dr. Roeker, you've done some really interesting research on Venetoclax and how it's being used. Can you explain that in sort of a patient-friendly way?
Absolutely. So we looked at a group of patients who had gotten Venetoclax off of clinical trial, meaning that their doctors had prescribed the medicine and then they started it.
This is like real-world data.
Real-world data.
Yeah.
So we looked at about 300 patients who were in this group, and they were treated in both academic and community centers in the United States as well as the United Kingdom. And we took a look at what exactly happened to these patients with their dosing, with adverse events, meaning complications or side effects from the treatment, and then tumor lysis syndrome.
And that's where too many cells are killed, the body can't handle it, the kidneys can't get rid of the waste materials, and the blood chemistry gets out of whack.
Exactly. So Venetoclax makes these CLL cells really just burst open. And when it does that, it releases all the salts that are on the inside of the cells into the bloodstream, and then the kidneys can be affected by it. So there are two different ways to look at tumor lysis syndrome. One is with blood tests, so just looking at the blood salts. And the second is clinical evidence of tumor lysis syndrome. And this is when the kidneys really are affected, and you can see that in the blood as well.
So you looked at, so this is kind of a retrospective data, you gathered information. So tell me a little bit about how the trial proceeded, what you were able to find out, and in terms of impact that would have for a CLL patient considering Venetoclax.
Absolutely. So there were 300 patients that we included, and we took a look at all of these patterns, and we found that when we were looking at the patterns of use in both community practices and academic practices, people really are doing quite a good job of following the FDA label. And the FDA label kind of outlines what is indicated in terms of medications to prevent tumor lysis syndrome from happening. And then also hospitalizations are a part of the dose ramp or dose escalation for patients who are getting Venetoclax. And people are doing this both in the community and academic setting, which was a great finding. It shows that the FDA label really is working and helping doctors make decisions.
And the whole packaging and dose ramp up, I think there was a lot of thought that went into that to make it easier and safer for patients.
Absolutely. So the initial clinical trials had a different strategy, and it was found to be not quite as safe. But with this modified strategy, the risks of TLS are very low, both in the clinical trial setting and now we're seeing as well in the real world setting.
Okay. So tell us a little bit about your findings in this group.
Yeah, so about 8% of patients developed tumor lysis syndrome. And that sounds high, but most of these cases were laboratory, meaning that they didn't have any lasting kidney damage or any issues from that.
And they didn't get sick.
Exactly. So there weren't any, there were a couple episodes of clinical TLS, which is of course what we all want to avoid. And then we looked a bit as well at outcomes in terms of if people weren't able to maintain the 400 milligram dose that is recommended on the label, what happens to these patients.
And they wouldn't be able to maintain it because they were having adverse events.
Side effects, or their blood counts were dropping.
Neutropenia, low neutrophil count would be a common one.
Exactly.
I suspect you saw, yeah.
Exactly. So about 40% of patients had low neutrophil count at some point while they were treated. But then we took a look at if patients did require their dose to go down, did that really affect their progression-free survival, which means from the time that they start treatment until their disease progresses. And we found that there wasn't any significant difference whether people had to interrupt therapy for a bit, or whether they had to dose reduce.
Wow. So it didn't affect the outcome if they were dose reduced.
Right,
wow.
Exactly. So if the patient isn't able to continue on that 400 milligram dose, these data suggest that there's still utility in this drug and it's still an active drug.
So I guess what I'm hearing is there was a concern that it was such a potent drug that it might be more difficult to be used in the community setting outside of an academic or research setting or a clinical trial. But it sounds like your data is reassuring for a patient.
Yeah, absolutely. I think there are a lot of good doctors out there doing a lot of good work, and I think that it can be a drug given safely in both settings.
Any additional things that you think patients should know about this research?
I think that if patients are having side effects, certainly talking to your provider as soon as possible about those is helpful, because it really does help your provider think about whether your dose needs to be adjusted or whether you need a short holiday from the medication. And I think that communication with your doctor is really key as you're starting venetoclax and then continuing it.
Dr. Roeker, thanks so much for your research.
Of
Thank you.
course,
Thanks.
yes.
Thanks.